these individuals know, they have a problem, and they know the stigma that does carry. And until we reduce that stigma and make that a priority, these folks may be hesitant to accept help from any service. Hi, my name is Mark Evon. I'm from Essex Windsor EMS. I'm a paramedic. I have been for the past 30 years, the last 5 of which I've spent in the Vulnerable Patient Navigator program, dealing with high-frequency 911 users, and most recently with mental health and response addiction team. That's new to to Essex Windsor EMS. I'll soon be working with a social worker with a focus on addictions. Our catchment area is Windsor-Essex County and Peely Island. We are based out of Tecumseh. As an EMS-based service, we do frequently see individuals suffering from addiction and opioid-related issues. We respond to multiple calls a day for opiate addiction issues and mental health also. More so, I would say, over probably the last 10 years, we've certainly seen an increase in those calls, and unfortunately, opioid-related deaths also. It translates into definitely an increase in service for us and also for the emergency departments. Whether our crews are supporting through, with Narcan or just supportive care en route to the hospital, there is a frustration with our EMS crews in the fact that we do see individuals over and over again for the same issues, and a lot of times without positive outcomes. So there is some frustration in that regard. However, we are trying to address it with the new MHeart team and try to meet these individuals in the community where they're at, and without judgment, without any expectations, but to hopefully direct them to the most appropriate care at the right time, at the right place. That's kind of where we're at, and the end result, hopefully reducing some of these calls and ER visits, and see more positive outcomes in the community for these individuals. My personal view on the opioid crisis, we've definitely seen an increase, I would say, over the past 10 years, certainly with those types of calls, as well as whether it's overdoses or opioid-related deaths. It's certainly been in the last 10 years we've seen definitely an increase in those areas, and again, unfortunately, we do see a lot of the same folks, and unfortunately not always a positive outcome. My perception, I would say, has changed quite a bit over the last little while, especially with my role as dealing with the vulnerable sector. Working on the emergency side of things, never really had the time to get to know the struggles, get to know these individuals, their past histories, what they've been going through, what's led them up to where they are today. Certainly, I don't think any of them have really chosen to end up where they are at this particular time. But given my role in the VPN department, it did allow me time to sit with individuals, get to know them, get to hear the stories, get to hear their struggles. There's trauma-related issues, whether it's physical, mental. There's a whole lot of aspects that go into just what led these people to be where they are today. And I guess from my own perspective, I can honestly say that there was a time I did stigmatize or marginalize these individuals because I truly didn't understand their struggles, and nor did I have time to get to know what their struggles were. So this new role allows me to get to know these people, meet them where they're at, without any judgment, without any expectations, listen to their stories. And they do have a lot of wisdom to offer and a lot of insight into what they are going through. And unfortunately, on the 911 side of things, we don't always have the time to get to know these people as individuals, more so as it's another call, and we're probably going to see them again in a couple of days. Now, with my current role, it does allow me to get to know these people and have a better perspective of what's going on in their lives, and to try to help them and direct them to the most appropriate services. From a frontline perspective, the opioid crisis is significant. We do respond to multiple calls in a day, whether it's for an overdose, it could be an overdose-related death, providing Narcan or supportive care en route to the emergency department. And there's an inherent risk with the job. We're in uncontrolled environments. When we're giving Narcan specifically, there's the risk of some aggression. There's some fear on the person's part that we're treating. They wake up, they can be confused, they can be combative with strange folks standing over them. So there is an inherent risk for our crews on the street that are responding to these calls on a daily basis. And not only that, we know the impacts are far-reaching with individuals that are suffering from addiction, whether it be family, co-workers, frontline workers, hospital staff, and it may hit close to home. We do know that there's a lot of this in the community, and it could be it could be one of their own family members or close friends that are suffering similar problems, and it brings that right to the forefront. So the impacts to staff on the front line are significant. The job is inherently stressful as it is. We respond to multiple calls in a day, and some of them can be the opioid-related calls, whether it's overdoses or just support for some of these people that are experiencing some trauma at that time or an emergency. We do know that these overdose calls are critical emergencies because the suppression of the respiratory system is significant and leads to hypoxia. So they're time-sensitive calls that require intervention quite quickly to hopefully have a positive outcome. So the stressors are certainly there. Fortunately, we do have a peer support system, and we do have some tools for our staff to access should they be experiencing a mental health issue themselves. So the opioid crisis certainly has an effect on the community, whether it's residents, whether it's our support services, whether it's the outreach teams that are working in the community. There's certainly a lot of work to be done. We see it in the homelessness in our downtown core for sure. Certainly has increased over the last number of years. It has a negative effect, I would think, on some of the businesses that are downtown also. However, we do know there's a lot of work going on in the backgrounds and in the forefront to try to address this crisis. Certainly through WECOSS, Positive Pathways, multitude of agencies working tirelessly to work on strategies to deal with this crisis, and it is a crisis. We know a multifaceted problem requires a multifaceted approach, and not one approach is going to solve this problem. It needs to be everybody coming together, working together for a common goal. As far as addressing the crisis, I believe it's a group effort. It's community, it's service providers, it's government, whether it's federal, municipal. The list goes on. It's certainly there's a lot of attention on it now, which is great, and we certainly all need to work together to reach that common goal. Whether that's more education as far as harm reduction, needle exchange programs, better access to services. I also feel too the less exposure to opioids when it's unnecessary, certainly at younger ages, and maybe better screening to address those people that may be at risk for addiction, and when we're prescribing medications or looking to treat somebody for whatever the cause is. Certainly there's a lot of focus now on this crisis, and a lot of people are paying attention. We've got a lot of working groups that are working together collaboratively on strategies to address the issue. Again, with WECOSS, with Positive Pathways, and again, there's multiple agencies working and working collaboratively, which is important, to try to address this crisis. We do know its significance, it's far-reaching, and it's going to take a large group effort to come up with good strategies and positive outcomes for these people that it's affecting. As far as doing better, I believe that we can always do better as a community, and when we're dealing with something like this, because there's better access to care, more timely access to treatment, certainly meeting people where they are, reducing stigma around the opiate addiction, because we do know it's not just a downtown problem, it's not just a homeless population problem. This problem affects everybody from all walks of life, rich, poor, young, old. It's multifaceted. It affects a multitude of people. So it's not just one population. However, back to homeless, we need better. We need more timely access to housing. We need maybe a broader needle exchange program. Again, more education on harm reduction is significant. We may not take that addiction away, but we can teach them strategies on how to use more safely. So MHART was established, mental health and addictions response team, to help address the opioid crisis that is going on in the community, as well as touch on some of the mental health aspects that go along with it. We'll soon be working with a social worker in collaboration with Hotel du Grace, and the goal is to meet these people in the community where they are, do assessments on them, and hopefully direct them to appropriate services in the community, and with the goal of hoping to keep them out of the emergency room and the 911 system. We talk about right care at the right place at the right time, and we know it's not always the emergency room. So if we can intervene before it becomes an overdose, or before it becomes an emergency, that is the goal, and hopefully to get these people connected to appropriate services and follow up with them also on their treatment, and try to keep them focused on their end goal, and to reduce the instances of overdose, and also provide education on harm reduction. And we also are providing naloxone kits to family, friends, any of the supports that are around them that that are there with them and in the community and part of the crisis themselves too. So the goal ultimately is to direct them towards treatment, harm reduction, and maybe educate the people around them on how to deal with some of these emergencies before they become a tragic event. So when we stigmatize these individuals, I believe it certainly has a negative impact on them, because they are aware of their issues and how people view them. So for us as a community, the destigmatization provides them an opportunity maybe to access care better where they wouldn't before, because they're stigmatized, or they may feel a certain way when dealing with whether it's EMS, whether it's police, or whether it's any community agency. When we can decrease that stigmatization, I believe it opens the door up for better access to care and more willingness to access that care. We know we have a large task at hand dealing with this opioid crisis. It is significant. There's a lot of work that needs to be done in the community and in the general population as a whole. Stigma is a huge barrier for these individuals. It does create a problem for them accessing care and the willingness to access care because of that stigma that's been put on them for several years, and it may not be new. These individuals know, they have a problem, and they know the stigma that does carry, and until we reduce that stigma and make that a priority, these folks may be hesitant to accept help from any service, whether it be us, whether it be police, whether it be any other community agency that's out there. So there needs to be a focus on that. A lot of education in the community, I think, needs to come to bring that to the forefront, Truly, I believe a lot of the general population doesn't understand what's going on. These people, they are individuals. They had hopes and dreams at some point. Unfortunately, something went wrong in their lives, whether it was a trauma, physical, mental, it could be anything. You know, and it's become an escape from their trauma, this addiction. And it's certainly the impacts are far-reaching, like I've said before, in the community, to family, friends, co-workers, emergency responders. It could be the healthcare workers in the hospital. There's the impact is great. And again, it's a multifaceted problem that certainly requires a multifaceted approach.